When I was in nursing school, I wanted to have hands-on experience, things that we were allowed to do in clinicals. We were also able to translate a lot of that here, which was great. How I like to describe it to friends and family, I ask, what kind of nursing do you do? I say, I work at a hospital that's kind of like a step down ICU, so they don't necessarily need ICU services, but they're critically ill, meaning they usually have like a long-term acute illness.
It's an excellent level of care to get into as far as nursing. You never get bored.
I love seeing people who are coming to work who are driven, they're goal-oriented, and they're reaching for things that maybe once upon a time they never saw themselves reaching for.
You really have to enjoy working, 100%. Nursing gives you that opportunity to where you can accomplish something great. And if you thrive on that, it's the best place to be.
You need to have a team spirit, you need to be flexible, you need to be able to want to learn. Be willing to say, okay, maybe I don't know the best way for this. This I need to learn from my coworker or my supervisor or whoever.
You learn something new every day here. I love it because that's what I enjoy. Everyone here is willing to teach you, and you can't find that everywhere. And I believe that if I didn't have the training that I did here and the people here that I learned from, I wouldn't be where I'm at today.
Everybody plays such a vital role in the care that we provide to our patients and the goals that we're working to achieve.
We can train you, we can give you the skills and the foundation to set you up for success, but it has to come from within. You have to have that drive and motivation to make a difference, to make a positive change in the lives of our patients.
We very much work as a team. We see patients here pretty much the worst days of their lives and the worst days of their families' lives. The families are going through it as well. So we try to offer as much support as we can from everybody on the care team.
If we can just deliver compassionate care from the time we step in the door to the time we leave, just the overall outcomes for the patient are better.
The stories, the journey, the clinical experience in itself, it is so rewarding.
We certainly want to grow the employees that are coming here. If you're a nursing assistant that's coming on board and you have, or a student nurse tech who wants to go to school and who wants to be a nurse, we will help them do that through a scholarship program. They submit an application if they're improved, and we pay for all of that.
They work with you through the whole process, and it goes all the way up to RNs as well. We can do our bachelor's program, and then even after that, you can keep moving up. Sky's the limit, I feel, especially here at Select.
If you look at most of the leadership that we have, even from first level leadership, your house supervisors, most of them, they were floor nurses. And most of them came to us as new grads. I see lots of cross training. I see lots of growth and opportunity for anybody that's came through. If we're gonna see that spark and that interest, we're gonna grab it.